If you or a loved one is receiving nutrition through an injection into the vein, fat emulsion 20% intravenous may be used to provide the necessary calories to support the body's energy needs. It can also help to address a deficiency in essential fatty acids, which can lead to issues like scaly skin, poor growth, and slow wound healing. This product is important for ensuring the body has the energy and nutrients it needs to function properly. It is important to follow your healthcare provider's instructions for the correct dosage and timing for this medication. When using this product, it is important to follow your doctor's instructions and check the liquid for any particles, oil, or discoloration before using it. If you notice any of these, do not use the liquid and consult your doctor or pharmacist if you are unsure about how to prepare or use it. Do not add any medication or minerals to the product container, except for heparin. The dosage of fat emulsion 20% intravenous is determined based on your medical condition, age, weight, and how you respond to the treatment. It is important to take this medication as directed by your doctor for it to be effective. Side effects of fat emulsion 20% intravenous may include headache, flushing, nausea, vomiting, or sweating. If any of these effects persist or worsen, notify your doctor or pharmacist immediately. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as signs of infection, pain/swelling/redness at the injection site or in the arms/legs, bluish skin, sudden weight gain, shortness of breath, chest or back pain, changes in mental/mood, bone pain, muscle weakness, easy bruising/bleeding, or signs of liver disease. In rare cases, this medication can cause serious breathing problems in newborns and infants if given too rapidly. It's important to closely monitor infants and newborns while receiving this product and seek medical help immediately if you notice rapid/shallow breathing. Although rare, a serious allergic reaction to this drug is possible. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. And remember, always consult your healthcare provider for medical advice about side effects. Before receiving the fat emulsion, it's important to let your doctor know if you have any allergies to it, eggs, safflower oil, or soy/peanut, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to share your medical history with your doctor, especially if you have high fat, lipid levels in the blood, liver disease, kidney disease, lung disease, anemia, or a blood clotting disorder. If you're planning to have surgery, make sure to inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at greater risk for bone pain and mental/mood changes while using this drug, and children may be at greater risk for liver disease. Newborns and infants may also be at greater risk for bone pain and mental/mood changes while using this drug. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. And if you are breastfeeding, consult your doctor before using this drug. When taking fat emulsion 20% intravenous, it is important to be aware of any potential drug interactions. It's essential to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor. Additionally, this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this drug. This will help ensure accurate test results and proper medical care. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help by calling 911. Otherwise, contacting a poison control center is recommended. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. Before starting fat emulsion 20% intravenous, it's important to undergo lab and/or medical tests, including a complete blood count, liver/kidney function, and lipid panel. These tests should also be performed while using the medication. It's crucial to keep all medical and lab appointments and consult your doctor for more details. This medication is used to provide calories and essential fatty acids for patients who are unable to eat or drink, and it may also be used as a source of calories for patients requiring parenteral nutrition. The daily dosage and optimal timing for this medication will be determined by your healthcare provider based on your individual needs. If you forget to take a dose of fat emulsion 20% intravenous, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one. Do not take double the dose to make up for the missed one. It's important to stick to your regular dosing schedule. When storing unopened containers of fat emulsion 20% intravenous, make sure to keep them at room temperature and away from light. Once the product is mixed, it can be stored in the refrigerator for up to 24 hours, but make sure to use it within that time frame. It's important to protect the product from freezing and to discard any partially used containers, as they should not be saved for later use. Keep all medications out of reach of children and pets. When you no longer need fat emulsion 20% intravenous, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to dispose of the product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.